This is Dr. Sonia Dhoot, and you are watching this because you have been diagnosed with a horseshoe retinal tear. A tear in your retina is something that is very common in patients who are nearsighted. If you're nearsighted, your eye is longer than it should be, so your retina is more thin and prone to ripping or tearing. When we see a tear or a hole or any defect in the retina, the concern is that you can get fluid underneath of that area and get a retinal detachment. A retinal detachment is one of the most serious things that can happen to the eye and can lead to permanent vision loss. So for that reason, we try to do everything we can to avoid that from happening. When we see a defect, whether it be a hole or a tear in your retina, we always recommend lasering it to prevent the risk of retinal detachment. The laser is pretty simple and straightforward and is done in the office. You sit in a machine just like the one you were examined in, and through the slit lamp, we do the laser. We put a contact lens on the eye to allow visualization of the tear, and we apply direct laser spots around the tear. What that does is it creates a wall around that tear so that if fluid tries to get underneath of it, it gets stuck and it can't propagate and cause a retinal detachment. The laser itself takes about 4 to 6 weeks to form a good scar. So although it's rare, you can detach while that laser is still taking effect. Because you have had a tear in the retina, you are at higher risk of having another one either in that eye or the other eye. So at any point, if you ever have any new floaters or flashing, or certainly a curtain over your vision, please call the office right away to be evaluated to make sure you don't have a new tear in your retina. Even during that 4 to 6 week window while this laser is taking effect, please let us know if your symptoms worsen. The laser itself takes about 10 minutes and is done in the office. We see you back about 2 weeks after the laser. Between when we laser you and that 2-week visit, we ask you not do any heavy lifting or bending over because that can weaken the laser and increase the chances of you having a complication like a retinal detachment. After we take the contact lens off of the eye after the laser, the vision is blurry for the first 30 minutes or so. And that's because of the contact lens and the gel that we use to do the laser itself. By the end of today, your vision should return back to what it was when you came in the office. The laser itself does not make the floaters go away, but they should with time get less noticeable. However, again, if they do get worse, it's something we need to hear about.